guys for giving us this hour and wanting to find out more about Nature Buddies. So just as a bit of a background, Nature Buddies has come from a project called Stepping into Nature that was running since 2017. We ran for 6 years, funded by the National Community Lottery. And we identified there was a gap between people getting sort of signposted for activities and going on those activities, and working with people like Natural England and finding out what they were doing. The Nature Buddies were sort of batted around and mentioned, and it was identified that there's this gap that people were falling through between actually going on an activity, getting signposted, and then going on an activity. And a lot of the time it was because they were unsure, they didn't have anybody to go with, and so they lacked confidence to be able to go on their own. So that's how Nature Buddies came about. We worked with Natural England on their toolkit, the Nature Buddies toolkit that they created. We ran a bit of a pilot, and then we managed to get some funding from the National Heritage Lottery to deliver a Nature Buddies network, or to build a Nature Buddies network over the next 18 months until June 2026. So that's where we're at the minute. We're just trying to build that network, get organisations involved in having Nature Buddies, having volunteer Nature Buddies, and then obviously you guys looking at how we get people to be referred onto that. So it's like a large pilot in a sense. So we are finding challenges, finding barriers, making changes, and trying to adapt it as we go along. Because ideally what we want is this to be part of the system as a whole. This is part of an option that people can be referred into Nature Buddies and be able to then get onto nature-based activities across Dorset for their well-being. And that's it in a nutshell. And I'll hand over to Kate now, who's going to present the first bit of the presentation, and then I'll pick up where she finishes.
Hi everyone, I'm just going to upload the presentation now. Just bear with me a moment. Okay, hopefully everyone can see that okay? Yeah, brilliant. Okay, so starting off, so we'll start off with Nature Buddies and what Nature Buddies are. So the purpose of the role. So Nature Buddies are trained volunteers, and their role is to support individuals to gradually increase their confidence and ability to get out and enjoy engaging with nature. And they'll support them to take part in nature-based activities and help them to overcome any barriers that might stand in their way. Their main aim is to be a kind of bridging the gap in between somebody being referred onto an activity and somebody actually going on that activity. They're the friendly face that helps them to do that. And we're asking our Nature Buddies to give us a commitment of about 6 months and about 1 to 2 hours a week for those 6 months to undertake the role. And there are various Nature Buddy roles that they could undertake. They could be a walking buddy with somebody and help them to get out into the landscape by gentle walks. They could be an activity buddy, and they could take somebody and participate in an activity alongside them. So that could be something like a gardening group, for example. Or it could be that they go to their home and they do some activities, some nature-based activities with them from home. So that could be something from their garden, it could be planting seeds, it could be watching the birds, that type of thing. Or it could be that they're based, for example, at a country park and they're a meet and greet person. So they'd meet that person and they'd be the friendly face at the gate. They'd show them where everything is and show them round and introduce them to the site. I should also say they might not be a nature expert, but they're somebody who wants to share their knowledge and passion with other people. So in terms of Nature Buddies, when we're talking about nature, we're also looking at nature and heritage combined. So we're looking at everything in the natural world, as well as the heritage that shapes our connection to it. So the plants, the animals, our landscapes and coastal areas, but also the traditions, stories, memories, and the history that can be shared through time. So what can a volunteer do? So the volunteers will meet with somebody regularly over an agreed period of time. And when that match is made between a buddy and participant, they'll agree that at that point of contact, so it could be, say, a 6-week period, that they'll meet once a week together and do that activity. And they'll take part in the nature-based activities together. Like we said, it could be walking, it could be a gardening group or something from home. And what they'll be doing is looking at eventually to integrate that person into some existing groups. So once the buddying comes to an end, they'll be looking at then helping them, for example, if they're interested in doing more walks, helping them to access a health walk group or a gardening group and other support networks around them. And it could be eventually that person even wants to become a nature buddy themselves and go full circle with it. But what the volunteers can't do is provide any kind of personal care or therapy. So they're not trained therapists. And they can't meet with a person outside of the agreed buddying times. It really is, there's kind of quite clear boundaries around that to make sure that everybody's kept safe and that the relationship is definitely considered to be a partnership relationship and it's not a friendship. It does have a set time limit to it. And the buddy also won't be able to provide transport necessarily. So it would depend on the host organisation of that volunteer, but it's probably highly unlikely. So the participant would need to be able to get to that activity themselves or meet the buddy somewhere. So the benefits of nature-based activities. So I'm sure this is something everybody's kind of really well aware of. And we just thought we'd put a snapshot here up on the screen for you to see. So we've got things like positive outcome for mental health and stress, helping to boost the immune system, help to reduce loneliness and isolation, helps to increase people's self-esteem and feelings of belonging. So there's some really good evidence to show that connecting with nature and heritage, whether it's just looking from your garden window or visiting out and about, can make a really, really big difference to your mental well-being. And there's some really good positive outcomes for people who who get out into the outdoors. So looking at some of the benefits of nature buddies, the volunteers themselves, there's some great benefits for them in terms of personal satisfaction and upskilling themselves. It's a very rewarding role for them. For participants, it's all about kind of staying physically and mentally well for longer periods of time, helping them to discover a new sense of purpose and enjoying activities they might not have tried before. And finding a sense of belonging through being part of a community group, so that increased friendship, social contact, but also doing something that matters to them. So it's looking at it matters to me story. For referrers like yourselves, it can really help to increase capacity. So having somebody you can trust to introduce your patients or clients to green spaces can be really beneficial. And it helps to get people out on activities and also helps to sustain their participation in those activities by having somebody to do it alongside them. So they're much more likely to keep on attending the activity and increase their confidence. Nature buddies can also help you to kind of increase your knowledge of the local area and activities to refer on to. And it's also a really nice way of kind of joint working. So you can work with that nature buddy to feel kind of supported with that person, so that you're confident that you're working with them on the activity they want to. You can work together to build that person's trust and confidence and their willingness to engage. Finally, just to kind of wrap that bit up, the nice quote from a buddy in a pilot scheme who said, "I found having a buddy is like a refuge, a calm, safe place with a lovely aura. This help is better than the doctors and has a ripple effect through the connections that are made. Nature buddies is a brilliant concept and I really enjoyed my walks with my buddy. My experiences have inspired me to try and do more walking and maybe one day the Archangel's Way." And now I'll hand over to Jules to talk more about the referral process.
Brilliant. Thanks, Kate. So this is how we think that it might work. for us, our first stab at doing this, and how it could work, which is why we're talking to you guys today, to see what you think and get your feedback on this. So who can access? So anybody is 18 and up, so it's for adults, and currently faces barriers to accessing and enjoying nature for their well-being. They must be ready to take active steps. So it's people that want to be able to get out and want to have nature-based activities for their well-being in a way that's meaningful for them. They're willing to try new things. And as Kate was mentioning, it's not about public regular transport or mobility sport or personal health care. People who need additional access, additional support could come, but they'd need to bring an additional support with them. So it's making sure that everybody still stays safe, but also that the right help is getting to the right people. So who can make a referral? Anybody really, providing there's consent given to the participants. So there's just a few referrals where they could come from: community mental health teams, GPs, social prescribing, link workers. There is a possibility for self-referral. We're going to explore that a little bit more further down the line. What information this is what information that we feel that the provider who's providing the nature buddy will receive from the referral. So we need age, address, and contact number, or at least age and contact number, summary of the support required, the kind of information on which nature-based activity they'd like to do, or if they've got a kind of a goal that they want to sort of achieve. Anything the buddy would need to know that would help them be sensitive to that person's situation. So if there's any triggers or any situations that they should be aware of, and then how the referral heard about the Nature Buddy service to help us with that feedback loop about how people are finding out about us. So the referrer, what we think the referral would need from the providers is obviously their name, what they are, a bit of an overview of what they can provide, where they are. We'll come back to the level of support in a moment. We want them to have accessibility levels. So we want to know whether it's an easy flat walking area for somebody with limited mobility, or whether it's a little bit hilly, or, so the accessibility level. So you guys would know that information about how you can refer somebody that's suitable, that the access level is suitable for that person. The length of support that they can give. So whether that's up to 6 weeks, which is what we're sort of a ballpark figure, what we're saying, it could be shorter than that, and then contact information. So the level of support we're looking at, we spoke to Nottingham Community Volunteer Service, who were running a similar project and running a similar thing with nature-based activities, and they work with social prescribers to come up with a mental health level of support, which can help providers to sort of grade themselves in what capacity and what support they can give to people to ensure that actually the people are getting the right amount of support. So they've come up with this mental health levels, which is kind of what we were hoping to use, but it'd be great to get feedback on these. So we feel that most nature buddies will be able to support the people in the first 3 levels, going from a person who's taken their own decision to improve their mental well-being, but maybe need a bit more guidance and help to actually attend that activity, to somebody who has receiving GP support and maybe some therapy, short-term medication. They are able to manage their mental health with that support, but they might need that initial support to be able to access the provision through social prescribing pathways. So we feel that that's probably the most of the nature buddies and most of the organisations will be able to provide support for that levels. And then the further 2 levels may need specialist nature buddies. So it could be that we have an organisation that actually can help support people that have more complex needs and needs a bit more additional support. And it's really dependent on that organisation of how they feel what the kind of support that they can actually give. And it may be that somebody starts off on a level 2 and as an organisation, and then actually they get some specialist training and they can actually then give more people with more complex needs that support to be able to get out.
Yeah. Jules, really sorry to interrupt, but the slides for me anyway are moving quite slowly. So we're just Yeah, we're just on the 3 levels, so maybe just pause to give people a chance to read that.
Okay.
Unless it's just me, I don't know. But Kate, I think you had issues, didn't you?
Yeah,
you want that?
so.
Yeah, the same for me. I'm just on the levels at the moment, so it would be good to have a pause so I can have a read of that, or other people, if that's okay.
Yeah. Which slide can you see now? Because I'm
10. Slide 10.
Yeah.
Mental
the level
health
0
levels.
to 2. Yeah.
Okay. There was a thing at the bottom that said sync to presenter, so it was obviously switched off. So I'm going to give you, so you can all see slide 10 now, which is the first 3 levels.
Yeah, that's right.
Right. I'll give you a minute to have a read of those.
Can we have the chat open as well to pop some questions in?
Yeah, is the chat not open?
It says it's only available during meeting, but I can't click on it or do anything with it. So, or should we just save them till the end?
Oh, it does say it's turned on.
Yeah, chat.
So I don't know why you can't.
Maybe it's just me.
I'm just putting a thing in now to see chat is open.
Yeah.
Yeah. Yeah, it's working.
No, it's just me. I'll save it till the end. Don't worry.
Okay, no worries. Okay, cool. Is everybody all right with those 3 levels? Is that all? Shall we move on to the others? Yep. So these were the 2 additional levels that they looked at, which is more complex needs. So these it could be an organisation that actually has a lower level, but
sorry, Jill,
the person
he's still on slide 10.
Oh, I don't know why it keeps doing that.
Okay, let me navigate to the next one, Jules. Just tell me when you want me to move on and I'll move them on. It seems to be working my side.
Yeah, I've only got, it says live sync to presenter at the bottom, so I don't know what that's doing. So yeah, do you want to move on to the next?
Yeah, we're on levels 3 and 4 now.
Oh, okay. See, I can't see that. I can't see that at my end. No, that's fine. That's fine. I'll just move on at my end. So you can all see the levels 3 and 4. Yeah, brilliant.
Yep.
So again, these 2 about people with more complex needs. So they may need to have an additional person with them, additional support person with them. But we felt that these levels were not to pigeonhole a person. These were more along the lines of the organisations who have the nature buddies to be able to say, this is the kind of support we can give. So actually everybody's aware of that. So rather than say to somebody, this is you, it's about the capacity and skills and experience of the actual organisations. So here we may need more specialist nature buddy support, or an organisation that actually is more specialised in that area. So I'll give you a minute for that. Okay, do you want to move on? Okay, so these are at the minute, these are the 3 pathways that we see that we have for nature buddies. So we're working with Volunteer Centre Dorset on around these offers as well. So it could be that we have a volunteer nature buddy linked to an organisation. So that organisation is the host, and that organisation is offering a nature-based activity. So their nature buddy is a volunteer that is within that organisation, and they can support that person to take part in that guided activity or around a nature site, if it's, say, somewhere like Upton Country Park. But they are stationed as part of that organisation. Then we have a nature buddy, walking buddy, accompanying people to walk from home. So we're trying to negate the whole transport issue. And that's a person that can help support a person to get out into the local green spaces or parks for a walk. And that could be somebody who helps that person to gain confidence to maybe join a local group or a walking group, or to be able to walk independently. And then the third one is a nature buddy helping somebody to get out into nature at home. So for some people, actually just getting out might be a massive thing, a barrier. And so that's somebody that can help them get out into the garden to carry out a task together. So for instance, that might be helping somebody get out in their greenhouse who's lost confidence, or get out into the garden with maybe that's what they have, or maybe the next steps of those getting out. That's really dependent on a case-by-case scenario. Next, these.
Okay.
So This is kind of like the pathway for how that works with a nature activity provider. So an activity provider that has a nature buddy but don't manage clients, so they're not going to manage the clients. So the referral process of it, we see that the referral could request a nature buddy support for that activity, so that person would want to go onto that activity either through ourselves or direct to the host provider. And then there is having a look at that mental health guidance and level support from that specific host, so the details from that specific host. And then there's a bit of a conversation between the referrer and the organisation to sort of make sure that those expectations and that support needs is a match, that they do have a nature buddy. And that nature buddy would have come in through either a new volunteer route or an existing volunteer that part of their role will be nature buddy, and they'll have had the induction training to become part of nature buddies. And then the nature buddy and the client will meet at agreed sessions to however when it comes to the end of their sessions or end of their time, and then that's dependent on whether the client's successfully engaging with the nature activity independently of the nature buddy, or they need additional support, and then it would have to come back round again. So the part where we're not sure is that whole, if the client needs additional support, whether referrers will come back into that conversation, whether that's the right activity for them, or they need a new nature buddy or an existing nature buddy if that nature buddy is happy. So that circle there is what we need to sort of have a look at how that works. And if they do then go on to with another nature buddy or engaging independently, the nature buddy could then be matched with a new client. So this sort of pathway is suited for those that want to attend a group activity. So the activity is already running. It's a simpler format. There's no loan working policies required, no DBS checks, and it can be more informal. So it's in a more informal way. Is everybody happy with that? So move on. Yeah.
Okay.
Next. So a lot of the different opportunities, there's a lot around managing expectations of what support is there. So it might be dependent on, and we're starting we're starting from scratch. So it might be dependent on whether there's available volunteers in the area for a start. We're initially looking at more focused areas, because trying to tackle Dorset as a whole is quite challenging. They're more likely to receive support if they need a helping hand to join an existing activity. So there's an exit strategy there to be able to put into place. If it is a longer duration, more personal support, then that would have to be looked in a bit further, and the client and the volunteer would have to be supported equally. We want to make sure that everybody's aware of the support that's needed and needs to be given, but nobody gets trapped into any circle that they can't for a longer period of time, and then there's less time of people becoming dependent on that one volunteer. So we're kind of aware of all of that and how we can work that. Okay, I'll come back to that soon in a sec. And they're not nature experts. We're not asking for volunteers to be nature experts or therapists or caregivers or drivers. They're people that want to help people to get out and spend time, and they're that friendly person who basically wants to help people engage in nature in a way that suits them. Next. So that's kind of the end of the formal discussion. I mean, if you want to talk to us one-to-one, or you have any other suggestions, then you can get in touch with us through Stepping Into Nature or give us a call. But we have got some, the rest of the time we wanted to use up to have a bit of discussion. So we have some questions for yourselves. So we want to know, if you flipped over, Kate, are you on the last slide?
I am now. Yeah.
I will pick up your questions in a minute. I just wanted you to mull this over before we stop the recording. So we want to know actually how this is going to work for you guys, and we want to invite your comments of how this initiative might work for you and your organisation. And we want you to be brutally honest. You know, we're big girls. We can manage it. We want to know who you're referring now and why you're referring them. So what actually do people fit the bill to be able to be referred to this? What do you think the likelihood of people attending should they get a nature buddy? so we can work on that if we need to work on that. And what are their biggest barriers? We know transport is a massive barrier, but is that the biggest barrier? Is that something that we should be really looking at? Or is there something else? So we're done with that then. So if do you want to come off of this if everybody knows those questions? And we'll stop the recording and presentation.